Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 50 of the Ask Dr. Angela podcast. I am so excited. I am finally starting to get pictures of folks wearing their bomb-ass Ask Dr. Angela t-shirts. If you're interested in seeing them, you can find them on my Facebook page, which is just Ask, A-S-K, Dr. Dr. Angela, A-N-G-E-L-A. I think we've also got them posted on my Twitter feed, which is just at Dr. Angela OBGYN. But anyway, it's nice that you all are finally not only getting the t-shirts, depending on where you are, sometimes it takes a while, i.e. in the Philippines, for you to get your t-shirts. But I'm super happy that you're posting them. They look fantastic, and just thank you so much for the support. So today we're going to be talking about external cephalic version, which basically is not even an option for you unless you have a baby that's in breech presentation. So before I start this whole, take or info session on external cephalic version and breech presentation, there are two general rules that I typically don't break. Number one, you should never ask a woman if she's pregnant. Let her volunteer that information for you. And number two, don't assign relationship to people. Don't assume that someone is someone's father, mother, whatever, because most of the time, I guarantee you will be wrong. This is a great example. So I saw a woman maybe, about a month or so ago, and I was evaluating her in our triage, and she was there with a woman and a gentleman. The woman that I was seeing as the patient was pretty young. She was in her 30s. It was not her first pregnancy, and she was for rule-out labor. I see a lot of people in triage for rule-out labor. She's having contractions. She has a history of being breech and was contemplating on whether or not to have an external cephalic version. But she was just kind of undecided. But at this point, the big thing was determining whether or not she was or was not in labor. And so I go into the room and I'm talking to her, and I, just a complete jackass, assumed that the woman and the gentleman that were with her were her parents. Talk about wrong and sticking both feet in your mouth. It turns out that the woman that was with her, number one, was her sister, and number two, the gentleman that was present was her husband. You can just never tell with people. Some folks look really old. People are sometimes doing some hard living. So again, the moral of the story is do not assume or assign relationship, because if you are anything like me, and I'm that person that if it's going to go wrong, it's going to go wrong, you would be wrong. So let's jump right into external cephalic version. And again, what that is an option that we give to moms if baby is not head down or cephalic. But we'll keep it simple and we'll just say head down. It seems to me that the perinatologists in my neck of the woods just love to do ultrasounds on folks. So aside from the basic anatomy scan, which is done between 18 and 20 weeks, folks are typically getting growth scans at 24, 28, 32 weeks, 36 weeks. Folks are just getting a lot of ultrasounds these days. At the 28-week mark, if someone tells me that they're breech, I don't get my panties too much in a bunch. It doesn't really raise my eyebrows too much because babies still have a lot of time and a lot of room to move around in. Babies inside your uterus at this gestational age, i.e. 28 weeks or so, are still doing backflips, cartwheels, somersaults, etc. Now, if you get to be 32 weeks or so and baby still breech, it still might not raise my eyebrows so much. But if we get to 36 weeks and baby still breech, then it probably grabs my attention a little bit more. When babies are not head down at 36 weeks or so, I've seen folks try a lot of different things. I've seen them go to chiropractors who say that they can perform certain manipulations that will cause babies to flip into the correct position, i.e. head down. I've had patients go online and get certain exercises. And if you could see me, you would see me putting quotation marks around the phrase exercises that are supposed to have the baby convert to being head down. The other option that we commonly discuss with women is this external cephalic version, or having the physician manually attempt to flip or rotate the baby into a head down position. For those patients that have babies that are breech and that are not interested in any of the things that I just mentioned, if baby's not head down, a vaginal delivery is not going to happen, and you can just end up with or elect to have a cesarean section with regards to route of delivery. So here are some things to consider when you are contemplating whether or not to attempt a version. Number one, are there any obvious contraindications to having it done? Number two, how far along are you in your pregnancy, i.e. are you greater than 37 weeks? Number three, what is the protocol that your particular hospital has in place for versions? Number four, what is your physician's success rate? And number five, what are potential complications of attempting a version? Now, with regards to contraindications to an external cephalic version, they're going to be things like how firmly fixed in the pelvis is the breech? How much fluid do you have around the baby? If you have low fluid, it's not going to be a good idea to attempt this. Where is the placenta? Something like a placenta previa is an obvious contraindication to attempting a version. Are there any signs of third trimester bleeding? Have you had a previous uterine surgery? How is baby's heart rate looking on the tracing? If it's non-reassuring, you certainly would not want to try a version. Is the baby's head hyperextended? These are all obvious contraindications to attempting an external cephalic version. Now, things that will affect whether or not the version attempt is successful or not are going to be things like, number one, how much amniotic fluid do you have? Number two, what's the size of the baby? Number three, where is the placenta? Number four, what's the size of the mom? Certainly in our more obese patients, it can be a little more difficult to get a hand on things, so to speak. Where is the location of the fetal back? And certainly more tips for folks in whom this is not their first pregnancy, versions seem to be a little easier. With regards to complications that can be associated with an external cephalic version, certainly you might have success only to have baby go back to being breech or revert. There's about a 3% chance of that. Fetal distress, baby may not tolerate the version. You might end up being admitted for observation, whether that's because the uterus is reactive or contracting, or there is some concern about baby's heart tracing. And certainly you could end up with an emergency C-section. As I previously stated, most facilities have a protocol for external cephalic version. And if you choose to undergo a version, I think that it's really important that you're familiar with this. Number one, are you going to have some kind of anesthesia? The operating room should always be on standby. There should be an ultrasound during the procedure to determine not only position initially, but also to keep an eye on position as well as, fetal heart rate during the procedure. You need to make sure, again, that the breech is not in the pelvis. Prior to even initiating the procedure, a non-stress test should be done to ensure fetal reactivity and that the baby is doing well. Certainly, you'll want to make sure that the uterus is not contracting, as that would certainly make attempting the version much more difficult. You have to determine, as the practitioner, how you're going to flip the baby. Are we going to do a front flip or a back flip with regards to verting the baby. Status post-aversion, you want to make sure, again, that you have a non-stress test to make sure that, baby is doing well. And for those folks that are Rh negative, you want to make sure that you get a dose of Rogam post-procedure. Success rates with version, it varies depending on your practitioner, how much experience they have with this, as well as, whether or not you're a good candidate for it. Most literature that I've read or come across quotes like a 44% success rate if the version is attempted after 36 weeks. And for those of you that decide not to attempt a version or to undergo a version, you can get an elective C-section at 39 weeks. So I hope that this information has been helpful, specifically to those that find yourself in the position of having a baby that's breech and you're like after 36 weeks. This will be some good information for you to ponder over. Thank you so much for tuning into episode 50 of the Ask Dr. Angela podcast. For those of you that have a topic that you would like featured, or if you have a question, that you would like to submit, please go to www.askdrangela. That's AskDrAngela.com. You can also email me at angela@askdrangela.com and submit your question or questions that way. If you do go to the website, you'll see the microphone on the right-hand side of the page. Just click on it and do what you do. To those of you that are sending me pictures wearing your bomb-ass t-shirts, keep them coming. Please keep those questions coming. If I use a topic or a question that you have suggested, I will send you personally one of my bomb-ass t-shirts. Someone from my team will reach out to you, gather your information, and we will get that right in the mail to you. In closing, I'd like to leave you with this. Success equals try plus believe. Joel Brown once said, "The only thing that stands between you and your dream is the will to try and the belief that it is actually possible." Until next time, look better, feel better, be better. Looking forward to reconnecting with you on episode 51 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.